What do we see when we compare the standard of care versus functional medicine delivery at the Cleveland Clinic? Great question for Dr. Patrick Hanaway on the Functional Forum.
Well, the data says that for mild to moderate depression, SSRIs don't do any better than placebo. And we don't hear that. We hear when they measure St. John's wort versus SSRIs that St. John's wort doesn't do any better than placebo for mild to moderate depression. Right? This isn't about green pharmacy. This is about saying, what's underneath? So we begin to look at things and we begin to say, we see that there are neuropsychiatric side effects for a cohort of patients who are eating gluten. Now, this is not the anti-gluten meeting. There's a subset of patients who have a specific response to what's going on. We see that patients who are on proton pump inhibitors will have bacterial overgrowth in the small intestine and decrease their ability to absorb nutrients in the terminal ileum. So now the data shows a correlation between proton pump inhibitor intake and depression. We know that seasonal affective disorder is related to the sunlight that we have, but there's also correlates with the amount of vitamin D we have. We recognize that antibiotics will change the gut microbiome and increase the risk of depression. We see that mercury that may be in foods like tuna will increase the risk of depression. We see that the dreaded sticky bun and the advanced glycosylated end products that come from type 2 diabetes and prediabetes and insulin resistance will increase the risk of depression. So if you got someone who's coming in with depression, do you give them an SSRI, which isn't going to be helpful if they've got mild to moderate depression, or do you say, I wonder why they have depression? What's underneath this? So we can take one disease and we can say there's lots of different potential causes. How do we begin to work through that process? We're going to give you the operating system and the tools, the way to think about it, so that you can do that with your patients. And oh, by the way, it works. You know, our preliminary data at the Cleveland Clinic looking at patient-reported outcomes measures, an NIH tool called PROMIS 10, so the validated tool, shows that in the sickest cohort of patients where we're comparing ourselves to family doctors at the clinic, that in the family medicine clinic, 28% of the patients are getting better. In the functional medicine clinic, 38% of the patients are getting better. On a relative basis, on an absolute basis, that's 10%. On a relative basis, that's a 40% improvement over what the standard of care is. It works. It works for people. Not only can we look at one disease and say it can manifest itself, or it can have many root causes, we can take one cause and say it may manifest itself in many different kinds of problems.
Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you. It's called the 5 Steps to Becoming a Leader in Your Wellness Community, and it'll give you some of the starting points on how to position yourself as the leader in your zip code of your health community. All you have to do is click on the link below.